has the initiative that there can also be cooperatives set up where a nonprofit organization could decide they're going to set up insurance that is nonprofit, but it's called a cooperative and it's member owned. And so those can come into the marketplace and compete on those exchanges also. And eventually, I think 2018, different entities, possibly insurance companies, will be able to come together across state lines and also provide a plan within those exchanges that will be multi-state. So think about that, a much bigger pool of possible insurees that hopefully would help to bring costs down at that time also. There will be proposals for individuals that they can just buy it individually, and then also that you'll be able to buy group insurance through the exchange. Most likely, from what I'm hearing, it will be done mainly online and mostly through a call center that you'll have to purchase those. Insurance agents, and I'll just give you this little aside, insurance agents lobbied hard to be able to sell through the exchange, and the government said, okay, we will require that anyone who is selling through the exchange these plans has to be a licensed person. But the law says this licensed person who helps you cannot be compensated. So that kind of puts me out of the ballpark as far as being able to do that service. So it's kind of interesting, and so we'll see how that all shakes out. Does that answer your question pretty much? Okay.
Yeah, I just had a question that my husband wanted to ask because he's a small business person in construction, and his understanding is that there is an exception to this requirement to provide insurance to employees. It's applicable to small businesses that don't have 250 employees or less than 250 employees, except in construction. Is that correct?
That construction companies will be required?
Right.
I had not heard that. If you and you have less than 50 employees?
Well, there's several. Right. Yeah. Right now we have 0. But you know, we're small.
No, I know that regulations, the rules are different for if you have above 50 employees, then you can get fined, and that's a whole nother thing I can go into if you want me to spend the time. Okay. But as far as I'm aware, if you have 2 to 50 employees, you are not required to provide health insurance.
Okay, thank you.
Kristen Pates from United Way of Story County. Dr. Kitchell, in your opening comments, you commented briefly on mental health and the role that that would have in this new bill. That is one of the identified areas of unmet need in Story County communities. Could you elaborate further on what would be included and the implications for the mental health arena?
Well, there's a shortage of mental health professionals right now around the country. We're suffering more here in central Iowa probably than most other areas of the country from that shortage of professionals. There will be some more parity, in other words, some better payment for mental health treatments, but also there will be some benefit to increase the number of people being trained, both for mental health and for primary care services. So I hope that in the future we won't have quite as much of a critical shortage. One other statistic that's really interesting, in Iowa, we're 44th in the nation for physicians per population. Only 6 states have more physicians per population than we do. And those are basically younger states like Utah, Idaho, Oklahoma. So the states that have the older populations, we're near the top. In other words, we're near the bottom of the number of physicians per patient that we have to take care of. And we have actually half as many physicians per population as Massachusetts has. and they are declaring a critical shortage of primary care physicians. In fact, internal medicine, they have 3.7 times as many internists as we have here in Iowa, but they claim that they have a critical shortage of internal medicine physicians. So this reimbursement problem that Mike talked about, here at McFarland Clinic, we have been searching for physicians despite the economy, despite the high unemployment rate. We have right now 25 openings for physicians at McFarland Clinic. And since I've been president in 1999, we've never had fewer than 24 openings for physicians. I'm a neurologist. We've been searching for neurologists for 6 years. We still have one opening. We got lucky and we've got somebody coming this summer. But so we've been looking for pulmonary specialists. We gave up on psychiatry quite a few years ago because it was just impossible to get them recruited here. So people say, you know, the reason that the physicians don't come to Iowa is not the lower pay. Okay, but why do they have to pay us lower? If they choose California, I understand that, but do we still need to be paid so much less than in California? We're paid 30% less for our professional services. We're paid 60% less for some of our diagnostic testing. Our anesthesiologists here in Iowa are paid 1/3 by Medicare what the private insurance companies pay the anesthesiologists here in Iowa. So you can see how this is really difficult for professionals here to keep the numbers up. And obviously what happened in Massachusetts was they covered more of their population with their new healthcare law, and they now have access problems getting in to see the doctor. But we already have those problems. Think what it's going to do if we have 5% more people wanting to see the same number of doctors. So it's going to be an access problem.
Hi, I'm Sue Benson, and actually I have 2 questions. The first is, I'm interested in, Dr. Kitchell, what you mentioned about rewarding for value, that component. I can imagine that component would be good for everybody, patients, physicians, hospitals, and insurance companies. So if any of you could explain that component a little more, I'd appreciate it. And secondly, Medicare reform hopefully is on the agenda sometime in the future. And if any of you have thoughts about, as citizens, what we should look for, advocate for Medicare reform as it fits with this new bill, then I would like to know that as well. Thank you.
I'll start with the pay for value. I think all of us want the highest quality care we can get, and I think we all want high quality care at a reasonable, affordable price. Well, as I said, the easiest way for me to show that we're not spending money wisely in healthcare is to just give you the example of the regional variation. McAllen, Texas, about $14,900 per patient per year. Miami, $16,300 per patient per year. They do more tests, more procedures. They keep people in the hospital longer. The last 6 months of life, they spend 3 to 4 times as much per patient. So people say, well, are the people in Miami 3 times as sick as they are here in Iowa? Well, they were all equally sick because they died 6 months later. So you just simply go back and you see how much was spent on the patient's care for that last 6 months of life. So here in Iowa, we have people who use advanced directives. They don't want to spend their last days of life in the intensive care unit, for example, or they don't want to have futile treatments for, like radiation therapy for their cancer, chemotherapy if it's not going to cause an